All right. So it's good to see y'all. Here we are. We're going to demonstrate in a moment here our last role play for your simulation experience here, which will focus on, how do you summarize and kind of close out with the client and do so ethically. Um, so before we get there, though, we wanted to talk about sort of some of the concepts that are informing the role play. So the first one we want to talk about is closure in therapy. And, um, before we got on to do this recording, Scott and I were talking about all the different ways in which closure may unfold in therapy. And what we really want you to take away with sort of base knowledge here is that you, as the therapist, as the counselor, have to make sure that you're initiating and helping the client move towards closure as you get there. That's part of our role, that clients are usually a little bit wary about how to engage in the process of wrapping it up. And this is a place where we can, really support the process. And as I always say to my, supervisees, if, maybe you only saw the client one time, but if they remember that counseling, was a good experience, then they'll be ready when they come back next time. And
Mhm.
so that's what we're looking to do here is really give them a good association with this experience.
Yeah, that's an important point that we didn't discuss beforehand, but I'm glad you mentioned, Abby, that one hopeful outcome is that should they find themselves needing therapy again in the future, they're willing to return, whether that's to you or to somebody else. But just that they have that, as you said, that positive association with the therapy experience enough that they know it can be supportive again. And I think an important thing to recognize is that when we approach closures, it's an ending. And that means both for the client and for you, it's going to bring up any feelings you have around goodbyes and closings and endings. And it's not uncommon for people not to really like saying goodbye or not to enjoy endings and therefore to avoid them.
Mm-hmm.
Or sometimes that manifests in different ways that we'll talk about in a second that you might see from the client. But so we'll talk about what might come up for the client, but also thinking about what is your relationship to closings and to endings, and to be mindful of your responsibility to facilitate that for the client, even if you know, or maybe particularly if you know that's something that makes you uncomfortable or you don't really like and you tend to therefore avoid. We can't avoid it as the therapists.
Yeah. I mean, I can, fully admit that it's not one of my favorite things to do. I do always tend to get a little bit anxious. And one of the ways that I address that, both for myself and for the client, is to, find some way to like ritualize the closing. So when I was doing college counseling, I would take the client's name and create an image. And then, for each letter of their name, I had a positive word, for the letter. And it was just as a way for me to ground and to be able to, summarize our work together and talk about how I saw these strengths really carry the client through. And also to, acknowledge that goodbyes are hard, and this is as hard for me as it is, for them. And but that goodbyes can be positive because that they are doors to new beginnings. And ultimately, I hope that my clients are establishing the kind of connection they have with me with the important people in their lives. And so, at the point of closure, I'm hoping that that's sort of part of the transition here. You might be losing this support system, but what else, based on everything that we've worked on together, might come into play here.
Mm-hmm. And the ritual, I love the ritual idea, and it kind of has me thinking about the fact that the closure experience is a closure experience for both of us.
Mm-hmm.
Our primary responsibility in the session itself is to the client and facilitating their closure. And so sometimes that means we get our closure within that as well. And other times we have to engage in actions outside of that session to have our own closure with the client. So the ritual Abby described could be something that happens in the session and is shared with the client, but also maybe something that happens outside of the session. And,
Right.
I definitely encourage you all to think about ways that your own, creative arts therapy modality might be useful, a movement ritual or an art ritual or a music ritual. And I've certainly used music rituals myself. And again, sometimes with the clients, but more often for my own closure outside of the session time. And sometimes
Yeah.
that was in preparation for it. So I could be grounded with the client, or sometimes it was afterwards because I knew I needed to process something else myself and could tap into the ritual. I think also we want to name for you the reality that closure can happen for a myriad of reasons.
Right.
We're kind of going to work with today we're working with a time delimitation. So that's an external factor, right? We only have 3 sessions together, and so we're ending. Ideally, we're ending because things have gone well and therapy
Right.
has been productive and the person's ready to move forward into the next phase of treatment or the next phase of their life. But essentially, closure can be initiated by the client, and we want to look closely at that. Are they initiating closure, saying they're done because they have achieved their goals and they're feeling good, or are they doing it because we had a really difficult session last week and they were confronted with some hard emotion and they don't want to deal with that, so I'm just going to be done with therapy? Can be initiated by us because we feel we've achieved goals and we're ready to move on. They're ready to move on, or even that we feel they could benefit from some other therapy or another therapist. We're not the right fit for them. That's another reason. So initiated by client, initiated by therapist, or initiated by external factors. That may be billing, that could be a death, whether that be the client, that could be simply somebody moving to a different place and not being able to continue together, or it can be time where we have
Yeah.
a 3-session structure here, and so we have no more sessions to be had.
And that was really typical for me, at least in college counseling. I typically was only allowed 6 to 8 sessions per student in terms of individual care. And when I did addictions counseling, clients would go through a process of stepping down, and the stepping down would lead to different levels of care. For example, something like an intensive outpatient group, which would be 3 hours, 3 times a week, to step down to 1 hour of individual therapy and, 2 hours of one group, and then moving to just individual, and then oftentimes individual moved into what they would call like an alumni group, so past clients could still keep that connection even if they didn't need it in the same kind of way. It was there to hold them. And or other issues would come up, right? So do they need new types of supports? And so goodbye is goodbye in this moment. It certainly does not mean goodbye forever. And I think that's also an important piece to explore with clients, especially those who have issues with grief or loss. I've certainly worked with a client or two who, as we really move through their trauma narrative around their loss, as we came to sort of the closure of that, they just kind of ghosted me. It was like, okay, like I'm feeling good and that's it, And so just to also remember that that isn't necessarily about you as the therapist. I wrote that client an email and said, I'm still here if you need me.
Mm-hmm.
But the goodbyes are hard for a lot of different reasons. And we just want to do what we can, essentially, what's within our control to give a positive ending. And that actually has a couple of ethical issues that we just wanted to highlight, because some stuff can come up at the end, so. Um,
Yeah, and I think that just to highlight really the importance of sort of that trauma-informed perspective. If we
mhm,
operate from a trauma-informed perspective, we're assuming and know the reality is a majority of our clients have experienced some level of trauma in their life. And
yes.
often those traumas connect to experiences of loss or abandonment
Mhm,
or, lack of attachment in early life.
mhm,
And so we want to prioritize creating an opportunity for them to experience a healthy version of ending. that doesn't
Yes.
feel like abandonment, although they sometimes still feel we're abandoning them, but that we're really modeling that there is such a thing as healthy ending and healthy closure.
Yeah. I have yet to meet a client who's come to therapy who wasn't in some way struggling with relationship boundaries. And so, of course, that can manifest in counseling or therapy. And so, clients who want to take you out on a date and or be your friend, it's certainly not uncommon to have clients say, "Can I follow you on Facebook, Instagram, all of those kinds of pieces?" And we do have ethics codes around this. You all will take a deep dive into that this summer. But what's just important to recognize in this moment is that you want to make sure that you're helping your client to understand sort of the confines of this special relationship, which is one where there might be friendship, in terms of the quality of relationship, but you are not going to be their friend, that is a boundary violation. Because the client needs that level of safety to be able to explore their traumas. And so, these boundaries are in place to help them. It's, even though it might feel really bad, I certainly have felt at times, with clients when I can tell they really just, like me as a person and want to hang out. But that's an important boundary within our profession.
Mm-hmm.
So,
Mm-hmm.
yeah.
Yeah, and I'm sure you may still have questions that you will take a deeper dive into in ethics, like, well, what if a certain amount of time passes, or what if we
Right.
wind up having a mutual friend in the future? There are all sorts of ethical questions that can come up. But as Abby was saying, we establish boundaries of the relationship so that there can be trust and safety within it to work towards therapeutic aims. It's essential, and we have to still uphold those as we come to an end.
Right. Exactly.
And
So,
that ending is clear too. I think that
yeah.
idea of this is maybe just goodbye for now. You're welcome to come back at some point, but it is goodbye. We are ending. You can't come back next week even if you want to. I'm not going to have a time slot. Your time slot's going to go to another client.
Yeah.
So that's the other aspect of it is making it. It's another thing that people tend to do when they don't like saying goodbyes, is like these soft goodbyes, or I'll see you when I see you kind of thing. And we can't do that. That's also unethical to kind of leave a dangling thread. We have to make it a clear ending. And if we return, even if it's a month later, they can come back. And we can restart and step back into the existing relationship, but we have to make it a clear end.
We must. It's critical. And it's scary for most. So it's good to have you as the therapist there to kind of let them know that that's okay, whatever's coming up for them, and to walk them through.
Mm-hmm.
And in a moment here, you will see just that. So far, just to review, you've had one session. Let me try to speak. Where you're done the intake. Then you did one where you did psychoeducation. And this final session will be focused on checking in with a client. How did they do with the exercises that you taught them about in the last time? And, any troubleshooting you might have to do around that. And then also starting to close with the client. And in fact, one of the things that you'll learn about with Theories and me with me this summer is that brief therapy, the philosophical basis for that approach is that you have a session and that might be your only session with your client. And so to treat, to just recognize sort of the time bounds. And you'll hear me say that to Scott as we walk through. We're coming to an end of this session, and here are some next steps to consider.
Mm-hmm. Yeah, and there, if you're having trouble envisioning a setting in which brief therapy might happen, just one simple example is a medical setting where a patient, is in the hospital for a brief period of time. You're seeing them at the bedside. You're offering psychosocial support, but you may only see them once. So you have an intake/assessment, treatment, and closure all in the scope of 45 minutes in a single session.
Yes. definitely happens. For better or for worse, unfortunately, short-term models, of course, are becoming more popular. So we all have to kind of, we're working within the system and without, outside of the system to change it, within it to get clients the care they need.
And I think the one last thing I want to say, maybe about our own need for closure and sometimes need to process outside of the session, is that it's very natural to wonder if we've been effective as a therapist.
Mm-hmm.
Have I actually helped this person? Am I making a difference? And B, to wonder what happens next for them or in the future. Are they okay? Do they go forward with those recommendations we've made and join a support group because they don't quite need therapy, but they still need some supportive care model? Are they successful in managing the life stressors we've been dealing with? And we don't get to know. We don't get to see that usually.
Right.
And we therefore have to develop techniques and trust, as we say in Philly and in therapy, trust the process, trust that therapy works, and trust that we're effective in our role of guiding that. But I think that is one of the harder things on the therapist side, is to wonder what happens to them. Are they okay?
Exactly. Absolutely. And it's totally natural. We are all human and we care for our clients. That's real. So good to acknowledge that. So in just a moment here, we're going to jump in, and this role play will be similar. We will actually be forwarding this to the SPs that you've been working with as an example, and we encourage you to use it as the same. All right. Hi, Sean. It's so good to see you. I know it's been a little while. I'm glad we're getting a chance to connect here. I kind of want to do a check-in with you and see how it went with some of the relaxation techniques we talked about and see how that went. But before we get there, let me just take a pause and, how's your week been? How are you doing? What's been going on?
It's good to see you. I'm doing all right today. It's just still the start of the week, so I imagine there's more to come. But so far, it's been all right. We didn't have any more snow to start the week, so the families, although the snow days were fun, they added some extra layers to all the COVID quarantine madness. So
it's the truth. Yeah.
Doing.
Do kids still have school, or
they're sort of in and out, some days there and some days at home.
Okay. So I'm curious about, just overall across the week, just checking in on a scale of 1 to 10, 1 being I didn't have anxiety at all, and 10 being it was off the chart. Sort of where was your anxiety level this week, if you had to give any kind of summary?
Maybe like a 6.
Okay.
It was not kind of 9 or 10, not the heightened levels I was feeling maybe when we first started talking. It's still there, not totally kind of low either.
Yeah. Tell me a little bit more about that. Is same kind of stuff going on in terms of stressors in your own life?
Yeah, I think kind of just still managing everything, feeling responsible to work and to family and trying not to let anybody down and keep up with everything.
It's hard to meet all those goals, especially during this time. And I think I just want to, because we are sort of, this is our third session. It is our last session because this is a brief short-term model. So I want to check in with you about some of the skills that you were practicing, and then also look at some other, maybe do some troubleshooting. It sounds like there's still some anxiety and some stressors, and that's normal, right? Like life will always be stressful, but let's see what we can do about, even reducing some of the suffering a little bit more.
That's how, to hear that is helpful because, people talk about, or I see on websites, just like remove stressors from your life. And,
Hmm.
you know, there are things that just can't go away. So, you know, I'm sort of hearing you helping me to figure out how to better handle those stressors. Not that I won't be stressed, but that
Right.
maybe the impact of them can be a little less
It's the
extreme.
truth. Yeah. It's a, we're all sort of learning and managing a new world out there post COVID. So that feels really, really on point to me. And, as a parent myself, I also recognize that level of stress. And as somebody who practices mindfulness, just a reminder that it does take about 8 weeks before you really get some of the impact.
Mm.
But but let's just start going through each one. So the first exercise we thought we'd have you try is the 4-7-8 breath, and I think maybe that you were going to get some kid support for that one around bedtime. And how did that work out?
That one was pretty good. If it was, you know, it was pretty quick. I could do it quickly. I didn't need a lot of time. I could do it with the kids. So I tried that a little bit. I think I had to let go for them and me of the numbers a little bit.
Hmm.
I, kind of realized I was getting a little anxious trying to make sure I was keeping the count right and sticking to the right numbers.
Okay.
But then found, as long as I was breathing in, pausing and breathing out, and kind of doing that intentionally, it seemed to have the same effect. So once I could stop worrying about the numbers, it was good because I could just kind of access it at any time and do it like quickly in the moment. And so, yeah, that one was helpful. I know the other one we talked about last time was the progressive muscle one that you kind of guided me in. That one I had a tougher time with.
Hmm. Hmm.
It seemed to like need a little more time and really alone time, which
Yeah.
it just wasn't happening. Anytime,
Right.
a lot of times when I tried to do it, I get partway through and I get interrupted, and so then I get
Yes.
frustrated, and it wasn't working.
I hear that. One of my favorite mindfulness teachers, Tara Brock, she says, sometimes my mindfulness practice is just me going, and good night. And that's it. So there's a reality to just having our plates very full. And so I can really, I understand where you're coming from with that. And so, and really part of the process of therapy, because there isn't sort of a one size fits all, is to try, a lot of different techniques and interventions, and really feel what works for you. Um, I might suggest doing it for another couple of weeks. I recognize the time boundary and want to respect that. Maybe there's a way that, I think there's a YouTube link that I found of a progressive muscle relaxation that I could send to you.
Yeah, that would
And
be helpful.
then,
I think I was
yeah,
also missing. I mean, I felt good when you were guiding me through it, but when I had to do it for myself, or it might be easier to stick with it if somebody else is telling me what to do. Sort of, I don't have to remember or anything. I just flip it on.
that's really common. I also need an anchor, is what it's called. Sometimes just something to really pay attention to, and to get us out of what mindfulness practitioners call monkey mind, just jumping and from one subject to the next, and not being able to come back to the present. And so maybe what we can look at is doing you know what are some troubleshooting, some ways that we might be able to support you. And it sounds like the breathing's going okay, and I'm really, it must be just adorable, with the kids. And if nothing else, the main effort of the exercise is to get you to breathe through the nose and out the mouth, diaphragmatic breathing, because we have a tendency to kind of, when we get stressed, we hold it in our body, and then we're real tight, and we're not sort of breathing from taking a full inhale and a full exhale. And we actually know, this is some information I can provide to you now, but, on a neurological basis, if we do that deep breathing in through the nose, out through the mouth, no special numbers, just doing, breathing naturally, that can really help to ground one. in terms of their anxiety and, just overall stress.
Mhm.
Um, so that might be one troubleshooting intervention that we can try.
Mhm.
Um, the other thing it could I'm hearing you, sort of talk about the role that your kids played and sort of that, because it was a ritual or, something you did together, that it was probably easier to do. So I wonder about, maybe even 2 minutes before bed, if you read it to your wife or your partner and, back and forth as a bedtime ritual,
Mm.
um, and just to acknowledge these changes are hard, right? Like I'm asking you to do something when you're already feeling stressed and overwhelmed, but it's sort of like exercise, it's one of those things where we just got to get the ball rolling and we'll feel significantly better. And
Mm.
so even a little bit, in fact, the research says 8 minutes of mindfulness a day, and it doesn't have to be even consecutive 8 minutes, that can really radically change your stress response.
Mm.
So just a couple of tidbits, to keep in mind as we're moving forward.
Yeah, I think if you could send me that YouTube link, that would be good. And I like the idea of maybe the script. If you have a version of that that you could send me, yeah, maybe I can try that out with a partner or with a kid.
Yeah, yeah, that sounds lovely. And it's true that I really believe this. Relationships motivate us. So the more that you can do this with those who are important to you in your life, just the easier it'll be to to establish the habit. Um, so I'm very grateful for your willingness to give those couple of techniques a try. And this is sort of part of the hurdle with brief therapy. It's brief. And so I do want to talk to you about sort of next steps and, what you might do next to help you sort of reduce and continue to address the anxiety. So does that sound good to you?
Yeah, yeah. I wish we weren't ending yet, I think, but I understand, that's kind of what I signed up for. So I understand. I also wish, I think, as you're talking about doing it with other people, I wish I could have my boss do the exercises and maybe they'd chill out a little bit and then I'd be less stressed because they'd be chilled out.
That would be the best. I'm not sure there's many who would disagree with you on that in relation to getting one's boss chilled out. That's for sure. So let's talk a little bit about um, next steps. Part of this agency, we do offer supportive groups. So after you go through this sort of intake process, initial coming into the agency, we do have groups such as a parent support group, because I do know the stress of the constant decision making process right now with COVID. It's very challenging. It's very stressful, very fatiguing, and it might be nice to connect with some other parents. That might be an option. There's a mindfulness and music group.
Mm.
There is a mindful meditation group. So we have a couple of different offers here. And then I also just want you to know, while this is short term, I am still a therapist. So if you need a referral for if those don't interest you, I do have a list of other providers, and we can talk about you know um, some other ways that you can receive support. um, does that
Yeah,
feel okay?
yeah. I'll give that some more thought. Yeah, I could see the benefit in connecting in a group with other people kind of going through some similar experiences, whether that be the parent one or one that's more focused specifically around anxiety. But I think I could yeah imagine the benefit. I mean, even though I have some friends and other parents I talk to, I don't always feel comfortable telling them about my anxiety or what I'm struggling with. So
Yeah.
sort of a group of strangers who have similar experiences, I can imagine being helpful.
Yeah, there's so, it's interesting, even as an introvert, I really know that you are more likely, any of us human beings are more likely to follow through on behaviors when we are accountable to other people. And so, it just might help to not only feel more supported, but to help getting the routine established around sort of, giving yourself some time and care and space for self compassion, because that's going to be critical to this continued addressing of the anxiety symptoms.
Yeah. And I know I've noticed with our 3 sessions, even though it's only been 3, they're in the calendar. I plan to have that time. I plan with my wife that I can have a room to be in and not be interrupted. And, like I said, I was hard finding enough time just to do the muscle relaxation. So, but yet I'm able to find this time. So yeah, having something that's like structured and scheduled allows me to sort of prioritize it, I think, in my own schedule.
Okay. Well, what I'll do then is I will follow up this session. I'll send you an email with a link of the progressive muscle relaxation. I'll have a link of and a description of some of these groups to consider. And if you have any questions, you're still welcome to give me a call or email me. And that will also include some resources for, for other places of treatment. It's really just about what you need, and I want to support you through that process. And then, the other piece is that we've been working together, and I've really enjoyed our time together. And well, I'm sad to have us wrap up together. I'm excited and happy to see you move on to new steps, and just want to thank you for your willingness and courage and continued effort, in our relationship together. I've really enjoyed our time together. I've never really, as I'm still a human being too, and at times it's harder, easier, and I felt like this is pretty easy. We had a good connection, and I'm really proud of the work that you've done, and while it might be a short time, it's been impactful.
Yeah. Thanks for saying that. I feel very connected to you. And yeah, I feel like it's been easy to get to know each other too. And I knew I only have 3 sessions, but I've been kind of wondering that if we're going to be done seeing each other like this, could I maybe like get your cell phone or something so that I don't know, maybe we could like grab a cup of coffee or lunch, here and there and catch up and hear more. I'd love to hear more about your kids and family and maybe, kind of, hang out a little more.
Uh, I first want to just say to you that I feel the same sense of closeness and connection with you. And, in maybe in an alternate reality, that would be a lovely event. Um, and unfortunately, in counseling, really for the better, we work to make sure this is a safe place for you. And one of the ways that we do that is really maintain our professional boundaries. So, I feel the same way with you. I feel connected to you. I'm really proud of the work that you've done. Um, but this is our closure. And have you, what has goodbyes been like for you in the past? I know sometimes it's hard to say goodbye. How is this feeling for you now?
Yeah, I think hard. I do have friends and loved ones, but not that many people that I talk to, about how I'm feeling.
Yeah.
And I think, as we've talked about, my anxiety really started around my parents' divorce and has grown out from there. And so and that was an ending that I didn't plan.
Right.
Saying so, I think since ever since then, I think I do have a hard time ending.
Mhm.
Um, I think I don't know if I don't want to end this
Yeah.
relationship, And I mean, you won't, but you won't be my therapist after this, right? Like, isn't it okay then?
Well, I will actually still always have this connection to you as your therapist. And, you are, well, I am not treating you anymore. If because that is the buy, unfortunately, that's what our structure is here at the agency. And I do have to respect it. So this is truly the end. And what I want to say to you though is that one of the main goals of therapy is to have the connection that we have in the relationships in your life that are important to you. And so part of what I think, why I think a group actually experience might be most beneficial as we're moving forward with your care is, to really get that sense of connection. And when we're anxious, we sometimes sort of shut down to that connection. It kind of immobilizes us a little bit. And the group is there to kind of give us that reality check, that transparency, and that level of connection that you deserve. I want you to have what we've been able to establish and more. And it's clear then that it's really possible for you because we've been able to do it very successfully.
Mhm.
And so, what I'd like to do in wrapping up is to celebrate what you have been able to do, where we have come, and also, I do have to respect the sort of the bounds of my relationship with you, but it doesn't take away the specialness of it. I just, I still feel very connected to you.
All right. I understand. I mean,
Yeah.
can accept that. And yeah, hope I appreciate the care you've given me. And I do hope that I can maybe cultivate this type of relationship, this type level of trust in the relationship. And I think is what I really feel, where I feel your support, that I can say almost anything, and you're not there judging me, to have that, in a different type of relationship.
Well, I think then, as we're wrapping up here, I think that's sort of where our focus should be. Let's make sure that we're working together. I'm actually friends with some of the other therapists here. If you're comfortable, I could even invite them in a second here, or connect them with you, so that you get a chance to meet them and see if you have that same level of rapport. And if you don't, that's okay too. That's therapy's about finding the right fit, and you were able to find it with me, and so I'm absolutely sure that you will find it again.
So is it okay if I still reach out to you on your work email, like if as I'm figuring out next steps, if I have questions and trying to
Absolutely,
make
and I would
decisions?
encourage you to. Yeah, yeah. I mean, you know, changing providers is a process, and so I expect that we'll continue to chat over the phone or via email to get you into your next best spot. Does
Mhm.
that feel okay?
Yeah, that sounds all right.
All right. Well, I have absolutely enjoyed our time together, and I look forward to hearing more updates as you move through this journey. And
Mm.
thank you so much for our time together.
Thank you.
All right, welcome back. Here we are. We just completed the role play, and we just wanted to do a short debrief because we didn't we wanted to talk about the experience of closure and also what you observed there in terms of boundary setting, because it is very common for your clients to want to ask you out on a date, to want to be your friend. This may be the first healthy relationship they've ever had, and so reiterating that boundary at times, it may feel like you need to say something new or different. But in fact, having, we were just discussing this, a consistent message all the way through will
Mhm.
help you to maintain the connection without rupturing it.
Mhm.
And, but it's clearly stating a clear boundary.
And you saw Abby do that, and clients can be very persistent
Mm-hmm.
where I role played that a little bit where she set the boundary and she let me know why, and I sort of got it. But what about this? So, yeah, I hear you're my therapist, you can, but now you're not my therapist anymore. And so, clients may continue to come at it, may not be satisfied with your answer, and that can sometimes lead us to want to shift gears and try to come up with a different reason than we've already given. But as you saw Abby, she kind of returned back to what she had already stated and just kind of maintained the same rationale throughout. Yeah, even though I was like fishing for something to like the loophole. I was looking as the client, I'm looking for that loophole. It's like, yeah, I get it. There you got rules, but there's got to be a loophole here somewhere where we can be friends. And so your ability to kind of stay situated. And the other thing, Abby leaned on two things. I would say she leaned on, which you can lean on. She leaned on our kind of ethics codes and professional responsibility and sort of rules of the agency. That is sometimes the clients need something concrete, and it can just be, sorry, it's the policy of the hospital or whatever that we're not allowed to have relationships outside of the office with clients. And sometimes they need, even if that's not 100% true of the only reason why that relationship can't happen, it sometimes can be a concrete thing that you can lean on that's not lying to them and gives them a really concrete reason why. Now, I will share, I've had a client question that too. Well, I won't tell anybody. The hospital won't know. And I've had to be like, yes, but I can. I'm sorry. So that, if a client feels really connected, they will kind of try every angle. So just, to stay grounded and stay within what is caring, but respectful boundaries.
And I want y'all to know, I wanted to continue caretaking for Sean. I was feeling that pull. I mean, you'll probably even see it at certain points in the video. Like, I wanted to continue to stay in connection, but I needed to recognize, there are some boundaries here, and they're important because we need clients to know. He even talked about, he had this difficult goodbye with his parents having a divorce, and that not all goodbyes need to be dramatic or painful. They might even be joyful, and that we can practice that even when they are feeling like they can't live without their therapist.
And not all clients will be that insightful to trace back to their childhood and parents' divorce. So
yes, yeah, but it definitely comes up. And one other example. If you are in recovery from substances, you might run into a client at an AA meeting, and there you sort of, usually we want to try to respect that. And if there's another meeting you can go to, that's a good idea. And then you really do have to be sort of aware as a counselor. This is why this is part of who we are, right? Because these ethics code follow us. So
right, we're bound by HIPAA whether we're in the office or we're at Houlihan's.
Exactly.
You're bringing up another ethical topic that'll get addressed further in ethics course, and that's what happens when we run into clients, whether during the course of treatment or after we've terminated in public, and it's going to happen to you.
Yes.
And some therapists who work in private practice don't see clients that live in their immediate area for that reason, to try to minimize that. Others do. Other areas of work, like addictions work, often you might encounter clients, but it will happen, and there are ethical ways to navigate that that you'll be able to dig into later. So we won't go into that for you now.
Right. But you just saw, I worked to close with him despite his wanting to continue. I maintained the boundary. And that's actually a particular technique called fogging. You just keep repeating what you're saying over and over. But I did pay attention to my modulation of my tone, the pacing, when and where I did do that. Those kind of pieces to make sure the impact to Sean was one of compassion. So. All right. Well, we look forward to hearing your thoughts about this. It is a process, and this is a way, not the way. So I hope that it was a good learning experience, and we look forward to your feedback.